Second white coat. Subscribe and like. Let's learn medicine together.
All right, today we're going to put on our detective hats and solve a really fascinating neurological puzzle. We've got a case where the body's signals get all crossed up in a very, very specific way. Our job is to follow the clues hidden deep inside the brain's anatomy to figure out exactly what's going on.
Okay, so let's dive right in. We all kind of know a stroke can cause weakness, but here's the mystery we're tackling today. What in the world does it mean when a patient shows up with weakness on the right side of their body, but the left side of their face? I mean, that seems like a total contradiction, right? But here's the thing. That strange combination is actually our single biggest clue. So let's meet our patient. We've got a 63-year-old man with a history of uncontrolled high blood pressure, and he suddenly experiences weakness. Now, here are the clues, and they are baffling. We've got a left facial droop, but weakness in his right arm and leg. His reflexes are also a bit too brisk on that right side. So, how can the face and body be affected on opposite sides? That is the puzzle we need to solve. Now, this seemingly confusing pattern is what neurologists call crossed findings. And honestly, understanding this one concept is pretty much the key to cracking the entire code of this medical mystery. So the official term is crossed findings, but it isn't just a description. It is a seriously powerful diagnostic tool. When a facial issue, like our patient's droop, is on the opposite side of the body from the limb weakness, it points like a giant flashing arrow to one specific region, the brainstem. This single clue immediately tells us where, in the huge complexity of the nervous system, we need to focus our investigation. So why does this even happen? Well, it all comes down to the brain's incredible and kind of weird wiring. The nerves that control your face, they generally stay on the same side, so the left brainstem controls the left face. Simple enough, but, and this is a big but, the major pathways that control your arms and legs, they cross over. The left side of your brain controls the right side of your body. The only place where these two completely different wiring systems are bundled tightly together, close enough to be damaged by a single event, is in that critical junction, the brainstem. Okay, so we've identified the brainstem as our crime scene. Now we've got to narrow it down to the exact location. And our best piece of evidence for that is the specific nerve that's been affected here, the facial nerve. This lets us build our case using a simple two-step logical trail. Step 1, identify the nerve. Well, the facial weakness points directly to cranial nerve 7, otherwise known as the facial nerve. Easy. Step 2, find out where it lives. That nerve's control center, its nucleus, is located in one specific part of the brainstem, called the pons. And boom, just like that, our investigation has zoomed in from the entire brain to one tiny, critical little structure. And here it is, right on the map. You can see the big outer cortex, but our focus is way deep inside on the brainstem. That's the structure connecting the main part of the brain to the spinal cord. And right there, that little bulge is the pons. This is exactly where all the evidence is pointing. You know, any good detective always checks their work by ruling out other suspects. So how can we be so sure it's the pons and not some other part of the brain, like the cortex, way up top, or maybe the cerebellum in the back? Well, let's check the alibis. If the problem were up in the cortex, the face and body weakness would be on the same side, not crossed. So that's a definite no. If it were the midbrain, we'd expect to see some eye movement problems. The medulla, probably issues with swallowing. The cerebellum would cause problems with coordination, like tremors. None of these other spots match our patient's specific set of clues. The evidence only fits the pons. Okay, so now let's get into what doctors like to call a high-yield detail. This is one of those subtle but incredibly powerful distinctions that helps neurologists confirm a diagnosis like this pretty much beyond a shadow of a doubt. You see, there's another subtle clue in how the face is weak. If a stroke happens up in the brain's cortex, the forehead is often spared. Why? Because it actually gets nerve signals from both sides of the brain. But if the damage is down in the brainstem, the entire side of the face is affected, forehead and all. Our patient's complete left-sided facial weakness, that's a classic sign that, once again, confirms the problem is in the brainstem. So, we've followed all the clues, we've checked all the alibis, and we've confirmed the fine details. It's time to bring it all together, state our case, and deliver the final diagnosis.
So here it is, the crucial point. The lesion, the area of damage from the stroke, is in the left pons. This one single event damages two totally separate pathways that just happen to be right next to each other. It hits the facial nerve nucleus, which causes weakness on the same side, the left face. And at the same time, it hits the motor pathways on their way down to the body before they've had a chance to cross over, which causes weakness on the opposite side, the right body. One location, two opposite effects.
And this very specific collection of symptoms, it actually has a name, Millard-Gubler Syndrome. It's a classic medical term for a stroke located right in the pons that produces this exact combination of same-side facial paralysis and opposite-side body weakness. Our medical mystery is officially solved. So what's the big takeaway from all this? It's this simple but incredibly powerful doctor's rule of thumb. If you ever see a case with facial weakness on one side and body weakness on the opposite side, especially in someone with risk factors like hypertension, your first thought should be a brainstem stroke. It's a classic pattern that just cuts right through all the complexity. It's really amazing when you stop and think about it. The brain's intricate, crisscrossing wiring means that one tiny point of damage can create such a complex and fascinating puzzle. It just leaves you wondering, what other medical mysteries are just waiting to be solved, hidden in the strange and beautiful maps of our own anatomy?